The Digital Global Health Group focuses currently a lot on climate change and health projects that we have in Burkina Faso, in Kenya and Malaysia, where we focus on how we can use sensor-based technologies on different levels, starting from the individual, where we use wearable devices, home-based sensors, where we put thermometers in people's homes, and we also use satellite-based technologies to understand impacts on a community level. So we are using these sensor-based technologies to understand health impacts of climate change on an individual level. So for the very first time, we are using wearable devices in very vulnerable and remote communities in Burkina Faso, as well as in Kenya, to actually understand on a quantitative level and on a very objective level for the first time how people move, how they move throughout their day, what kind of activities they do during the day, when they expose themselves in particular to very vulnerable environmental exposures, like for example heat, but also rainfall or high humidity, for example. We understand their sleeping patterns, so when do people go to bed, when do they get up, how often is their sleep interrupted, and we also get information on a continuous level on heart rate. So for the very first time, we're collecting continuous data for longer time periods covering years, because usually the data that we collect is cross-sectional, so we only collect data at one point in time, which doesn't really give us a lot of information how people react to environmental exposures like heat, for example, because it's not just a one-time reaction. Depending on your exposure, your individual reactions will vary, and we do not have any data on that. So this is what we do for the very first time, and as a first step, we feasibility tested these wearables in these contexts. And this is primarily our focus, where we have hosted a lot of projects too, including, for example, malaria prediction, which we also feed data from the wearable devices using heart rate, for example, to predict malaria symptoms or pre-symptomatic malaria based on heart rate, essentially. So deviations, individual level deviations from heart rate. So if we see that your heart rate on an individual level deviates from what we normally would expect based on your heart rate measurements, we are able to see these outbreaks, for example, like malaria as well. So we can, in the future, send individualized text messages or information via the wearable to people, acting in a preventative way instead of a reactive way. So instead of waiting until you get sick, you can do something about it much earlier, preventing you from hopefully getting very sick, and then you hopefully will also be able to continue doing your daily activities, care for your family, do your work, and in that sense it's also very, very important for malaria surveillance, for example, as well. So we can nest many different projects with the wearable devices that are in relation to climate change and health.